New Hardest NCLEX Questions 2026 Part 2, 50 Difficult Questions and Answers. Question 1. What is the normal range for central venous pressure, CVP? A. 2 to 8 mmHg. B. 10 to 20 mmHg. C. 15 to 25 mmHg. Or D. 25 to 30 mmHg. The correct answer is A. 2 to 8 mmHg. Normal CVP is 2 to 8 mmHg. Elevated CVP indicates fluid volume overload, while low CVP indicates hypovolemia. Question 2. A client with chronic kidney disease, CKD, should limit which of the following in their diet? A. Carbohydrates. B. Protein, potassium, and phosphorus. C. Fats. Or D. Vitamin C. The correct answer is B. Protein, potassium, and phosphorus. Patients with CKD need to limit protein to reduce uremia, potassium, and phosphorus to prevent complications. Question 3. A patient with a nasogastric (ING) tube is receiving enteral feedings. How should the nurse position them? A. Supine. B. Trendelenburg. C. Head of bed elevated 30 to 45 degrees. Or D. Left lateral. The correct answer is C. Head of bed elevated 30 to 45 degrees. Elevating the hob to 30 to 45 degrees helps prevent aspiration during continuous or intermittent enteral feedings. Question 4. The nurse is caring for a patient with pancreatitis. Which lab value is most specific to this diagnosis? A. Elevated BUN. B. Elevated amylase and lipase. C. Decreased calcium. Or D. Elevated AST and ALT. The correct answer is B. Elevated amylase and lipase. Amylase and lipase are enzymes produced by the pancreas and are elevated during acute pancreatitis. Question 5. A client with heart failure is receiving furosemide. Which finding requires immediate intervention? A. Potassium level 3.2 milliequivalent/Lb. Blood pressure 110/70 mmHg. C. Weight loss of 2 pounds. Or D. Urine output 50 ml/hr. The correct answer is A. Potassium level 3.2 milliequivalent/L. Hypokalemia is a common complication of loop diuretics and can lead to dangerous arrhythmias. Immediate intervention is required. Question 6. Which finding in a patient with a cast indicates compartment syndrome? A. Itching under the cast. B. Pain relieved by analgesics. C. Capillary refill of 2 seconds. Or D. Numbness and tingling in toes. The correct answer is D. Numbness and tingling in toes. Numbness, tingling, and severe pain unrelieved by medication are signs of compartment syndrome, requiring immediate intervention. Question 7. A patient is experiencing an acute asthma attack. Which medication should the nurse administer first? A. Inhaled corticosteroids. B. Oral prednisone. C. Albuterol nebulizer. Or D. Montelukast. The correct answer is C. Albuterol nebulizer. Albuterol is a short-acting beta-agonist, SATA, used as a rescue inhaler for acute bronchospasm. Question 8. What is the therapeutic range for digoxin? A. 0.5 to 2.0 ing/ml. B. 2.5 to 4.0 ing/ml. C. 5 to 10 ing/ml. Or D. 10 to 20 ing/ml. The correct answer is A. 0.5 to 2.0 ing/ml. The therapeutic range for digoxin is narrow, 0.5 to 2.0 ing/ml. Levels above 2.0 indicate toxicity. Question 9. A client in labor is receiving oxytocin. The nurse notes late decelerations. What is the first action? A. Increase oxytocin. B. Reposition the client to the left side. C. Administer oxygen. Or D. Stop the oxytocin infusion. The correct answer is D. Stop the oxytocin infusion. Late decelerations indicate uteroplacental insufficiency. The priority is to stop the oxytocin to reduce uterine contractions, then reposition and give O2. Question 10. A patient receiving blood transfusion develops fever and chills 15 minutes in. What is the first action? A. Administer antipyretics. B. Slow the infusion rate. C. Stop the transfusion. Or D. Notify the physician. The correct answer is C. Stop the transfusion. The first action for any suspected transfusion reaction is to stop the transfusion immediately to prevent further adverse effects. Question 11. A client is admitted with suspected meningitis. What is the priority nursing action? A. Administer antibiotics. B. Institute droplet precautions. C. Dim the lights. Or D. Prepare for lumbar puncture. The correct answer is B. Institute droplet precautions. Instituting droplet precautions is the priority to prevent the spread of infection before other interventions. Question 12. The nurse is teaching a patient about lithium therapy. Which instruction is crucial? A. Restrict fluid intake. B. Maintain consistent sodium intake. C. Take on an empty stomach. Or D. Stop medication if feeling better. The correct answer is B. Maintain consistent sodium intake. Lithium levels are sensitive to sodium levels. Decreased sodium intake can lead to lithium toxicity. Question 13. Which task can the RN delegate to unlicensed assistive personnel, UAP? A. Assessing a newly admitted patient. B. Administering for pain medication. C. Measuring intake and output. Or D. Providing discharge teaching. The correct answer is C. Measuring intake and output. UAPs can perform basic care tasks like measuring INO, assessing, administering for meds, and teaching require RN judgment. Question 14. A client has a chest tube. The nurse notes continuous bubbling in the water seal chamber. What does this indicate? A. Normal function. B. An air leak. C. Lung has re-expanded. Or D. Suction is too high. The correct answer is B. An air leak. Continuous bubbling in the water seal chamber indicates an air leak in the system, which needs investigation. Question 15. A patient has a potassium level of 6.5 milliequivalent/L. Which ECG change is expected? A. Peaked T waves. B. Prominent U waves. C. ST depression. Or D. Inverted T waves. The correct answer is A. Peaked T waves. Hyperkalemia typically causes tall, peaked T waves, widened QRS complexes, and can lead to cardiac arrest. Question 16. A nurse is caring for a patient on a ventilator. The high-pressure alarm sounds. What is the most likely cause? A. Disconnection from the ventilator. B. Patient needs suctioning. C. Cuff leak. Or D. Extubation. The correct answer is B. Patient needs suctioning. A high-pressure alarm indicates resistance to airflow, often caused by secretions requiring suctioning, biting the tube, or bronchospasm. Question 17. A pregnant client at 32 weeks presents with painless, bright red vaginal bleeding. What is suspected? A. Placenta previa. B. Abruptio placentae. C. Ectopic pregnancy. Or D. Normal spotting. The correct answer is A. Placenta previa. Painless, bright red bleeding in the third trimester is a classic sign of placenta previa. Question 18. A patient is taking warfarin. What is the antidote for warfarin toxicity? A. Protamine sulfate. B. Vitamin K. C. Flumazenol. Or D. Naloxone. The correct answer is B. Vitamin K. Vitamin K is the antidote for warfarin. Protamine is for heparin, flumazenol for benzos, and naloxone for opioids. Question 19. Which symptom is a classic sign of deep vein thrombosis, DVT? A. Unilateral leg swelling and pain. B. Bilateral pedal edema. C. Cold, pale extremities. Or D. Absent pedal pulses. The correct answer is A. Unilateral leg swelling and pain. Unilateral leg swelling, pain, warmth, and erythema are classic signs of DVT. Cold and pulseless legs indicate arterial issues. Question 20. A patient with diabetes is unresponsive with a blood glucose of 40 mg/dl. What should the nurse do? A. Give oral juice. B. Administer insulin. C. Administer 450% dextrose. Or D. Recheck glucose in 1 hour. The correct answer is C. Administer 450% dextrose. For an unresponsive patient with severe hypoglycemia, for dextrose or IM glucagon is required since they cannot safely swallow.